Welcome to the Health Awareness Podcast, your reliable companion for evidence-based health knowledge and wellness guide. Our goal is to keep you informed, supported, and empowered on your journey to better health. For links, updates, and additional resources, please check the description.
Welcome, health enthusiasts, to another episode of the Health Awareness Podcast. I'm Jenny, and with me, as always, is Dr. Mark.
Great to be here, Jenny, and hello, everyone. We've got a really important topic today, one that touches millions of lives globally. We're going to demystify diabetes.
That's right, Mark. Diabetes is a word we hear a lot, but for many, it's still shrouded in a bit of mystery and sometimes, unfortunately, fear. We want to break it down into easy-to-understand language, focusing on the symptoms, treatments, and most importantly, prevention.
Yes, and our goal today is to empower you with knowledge. Whether you have diabetes, know someone who does, or just want to understand how to keep yourself healthy, you'll walk away from this episode with a much clearer picture of what diabetes is, why it matters so much, and what practical steps you can take.
So let's dive right in. Dr. Mark, in its simplest terms, what exactly is diabetes?
All right, great starting point, Jenny. At its core, diabetes mellitus, that's its full medical name, is a chronic condition characterized by high levels of sugar or glucose in the blood. Our bodies get glucose from the food we eat, and it's our main source of energy. Now, to get that glucose from the bloodstream into our cells where it can be used for energy, we need a hormone called insulin. Insulin is like a key that unlocks the cells to let the glucose in.
So if insulin is the key, what happens in diabetes?
Well, in diabetes, either your body doesn't produce enough insulin, or the insulin it does produce isn't used effectively. Imagine trying to open a door, but you either don't have the key or the key just doesn't quite fit anymore. When that happens, glucose stays in your bloodstream instead of going into your cells, leading to persistently high blood sugar levels. Over time, these high sugar levels can damage various organs and systems throughout your body.
That makes a lot of sense. So it's really about our bodies struggling to manage blood sugar effectively. Now, I know there isn't just one type of diabetes, right? Can you walk us through the main classifications?
Absolutely, Jenny. Understanding the types is crucial because they have different causes and management approaches. The three main types we usually talk about are type 1, type 2, and gestational diabetes.
Okay, let's start with type 1.
Type 1 diabetes, which used to be called juvenile diabetes or insulin-dependent diabetes, is an autoimmune condition. This means your body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas, called beta cells. Because these cells are destroyed, the body can't produce insulin at all, or produces very little. It typically develops in childhood or adolescence, but can occur at any age. People with type 1 diabetes require daily insulin injections or an insulin pump to survive because their body simply cannot make the insulin it needs.
So it's essentially a complete lack of insulin production. And type 2, which I believe is far more common.
Heck, you're absolutely right. Type 2 diabetes accounts for about 90 to 95% of all diagnosed cases. Here, the problem isn't usually a complete lack of insulin initially. Instead, it's a combination of two things. First, insulin resistance, meaning your body's cells don't respond effectively to insulin, so that key doesn't unlock the cells properly. And second, over time, the pancreas might not be able to produce enough insulin to overcome this resistance. Type 2 diabetes is often linked to lifestyle factors like obesity and physical inactivity, and it typically develops in adults, though we're unfortunately seeing it more and more in younger individuals.
That's a stark difference. And then gestational diabetes?
Gestational diabetes develops during pregnancy in women who haven't had diabetes before. Hormones produced by the placenta can make the body's cells more resistant to insulin. While it usually resolves after the baby is born, it significantly increases the mother's risk of developing type 2 diabetes later in life and can also impact the baby's health.
So one is autoimmune, one is largely lifestyle related, and one is pregnancy induced. Knowing these differences is so important. Now, let's talk about what people might actually feel. What are some of the early signs and symptoms of diabetes that someone should be aware of?
This is where early detection really makes a difference, Jenny. One of the most common early signs is increased thirst, or polyphagia, we say medically. You'll find yourself constantly wanting to drink water, feeling parched even after you've had a glass.
And why does that happen?
Because your body is trying to get rid of the excess sugar in your blood. Your kidneys work overtime, trying to filter out and excrete that sugar through your urine. This leads directly to the second common symptom, frequent urination, or polyuria. You'll notice yourself needing to go to the bathroom much more often than usual, sometimes waking up multiple times during the night.
So you're constantly thirsty because you're constantly losing fluids. That makes sense.
Exactly. And because your cells aren't getting the glucose they need for energy, despite all that sugar in your blood, your body still thinks it's starving for fuel. This leads to increased hunger, or polyphagia. You eat, but you still feel hungry shortly after.
That's quite a confusing signal for the body.
It really is. And all this inefficiency often translates into persistent fatigue. You feel tired and sluggish, even after a full night's sleep, because your cells aren't getting the energy they require. Other signs can include blurred vision, as high sugar levels can affect the lenses of your eyes, and slow-healing sores or frequent infections, because elevated glucose can impair your immune system and circulation. And surprisingly, unexplained weight loss can be a symptom, especially in type 1, as the body starts breaking down muscle and fat for energy when glucose can't get into cells. For type 2, sometimes gradual weight gain can precede diagnosis.
Those are a lot of symptoms, and some of them, like fatigue or increased thirst, can easily be dismissed as just being a busy day or not drinking enough water. It sounds like it's easy to miss these early warning signs.
You're absolutely right, Jenny. Many people initially dismiss these symptoms because they can be subtle or seem tied to other factors. For example, I'm just getting older, so I'm more tired, or I've been working out more, that's why I'm thirsty. The onset of type 2 diabetes, in particular, can be very gradual, sometimes developing over years, so people might not even notice the changes until the condition is quite advanced.
Which brings us to a crucial point. Why is diabetes considered so dangerous if left untreated or poorly managed?
This is the segment where we really need to emphasize the why. In the short term, acutely high blood sugar can lead to serious conditions like diabetic ketoacidosis, or DKA, mostly in type 1, where the body produces harmful acids called ketones. It's a medical emergency. For type 2, extremely high blood sugar can lead to something called hyperosmolar hyperglycemic state, or HHS, which is also incredibly serious and requires immediate hospital care. And for those on insulin or certain medications, having blood sugar drop too low, or hypoglycemia, can also be very dangerous, leading to confusion, seizures, or even unconsciousness.
So both too high and too low can be life-threatening. What about the long-term complications?
The long-term effects are devastating, unfortunately. Chronically high blood sugar damages blood vessels and nerves throughout the body. This significantly increases the risk of heart disease and stroke, making diabetes a leading cause of cardiovascular issues. It's also the leading cause of kidney failure, requiring dialysis or a kidney transplant. Nerve damage, or neuropathy, can lead to numbness, pain, or weakness, especially in the feet, which can then lead to serious foot ulcers, infections, and even amputations if not managed carefully.
I've heard about the impact on vision, too.
Yes, retinopathy, or damage to the blood vessels in the retina, is a major concern and can lead to blindness if left unchecked. It can also cause cataracts and glaucoma. So you see, diabetes isn't just about managing blood sugar. It's about protecting your entire body from a cascade of serious health problems that can severely impact quality of life and even shorten lifespan. That's why awareness and proactive management are so critically important.
It really puts into perspective why this topic deserves our full attention. Let's shift to understanding why people get diabetes. What are the main causes and risk factors?
Excellent question. The causes are quite different between type 1 and type 2, but there are some overlaps in terms of overall risk. For type 1 diabetes, as we mentioned, it's an autoimmune disease. While we don't fully understand why some people develop it, there's a strong genetic component, meaning it can run in families, and environmental triggers like certain viral infections are thought to play a role in susceptible individuals.
So type 1 is less about choice and more about genetic predisposition and environmental factors.
Precisely. Now, for type 2 diabetes, the picture is much more complex and often involves a combination of genetic and lifestyle factors. Genetics play a significant role here too. If your parents or siblings have type 2, your risk is higher. But lifestyle factors are huge. The biggest one is obesity, especially abdominal obesity, where fat accumulates around your waist. This excess fat tissue makes your body's cells more resistant to insulin.
So carrying extra weight, especially around the belly, makes that insulin key less effective?
Exactly. Other lifestyle factors include a sedentary lifestyle, not getting enough physical activity. Exercise helps your cells become more sensitive to insulin. Poor diet, especially one high in processed foods, sugary drinks, and unhealthy fats, also contributes greatly. And we're even seeing environmental factors like certain pollutants or chemicals potentially playing a role, though research is ongoing there.
What about behavioral factors outside of diet and exercise?
Things like smoking can increase insulin resistance and damage blood vessels, raising risk. Chronic stress, which can elevate cortisol levels, can also contribute to higher blood sugar over time. Even poor sleep habits can mess with your body's hormone regulation, including insulin sensitivity. So you can see, for type 2, it's often a perfect storm of multiple factors converging to create the condition.
That's a lot to consider. Given all these potential risks and symptoms, how exactly is diabetes diagnosed?
The diagnosis is typically straightforward and involves a few key blood tests. One of the most common is the fasting plasma glucose test. As the name suggests, you fast overnight, usually for 8 to 10 hours, and then your blood sugar is measured. A normal fasting glucose is below 100 milligrams per deciliter, or mg/dl. If it's between 100 and 125 milligrams DL, that indicates prediabetes, which means your blood sugar is higher than normal but not yet in the diabetic range. A fasting glucose of 126 milligrams DL or higher on 2 separate tests confirms a diagnosis of diabetes.
So prediabetes is like a warning sign, a chance to make changes before it becomes full-blown diabetes.
Exactly. Another important test is the oral glucose tolerance test, or OGTT. For this one, you fast overnight, have a baseline blood sugar taken, then drink a sugary solution, and your blood sugar is measured again after 2 hours. This shows how well your body processes sugar. If your 2-hour blood sugar is 200 milligrams DL or higher, that indicates diabetes.
And the test I hear about most often is the A1C, right?
That's right, the HbA1c test, or glycated hemoglobin. This one is great because it gives us an average of your blood sugar levels over the past 2 to 3 months. It doesn't require fasting and can be very useful for both diagnosis and monitoring. A normal A1C is below 5.7%. 5.7 to 6.4% indicates prediabetes, and 6.5% or higher confirms diabetes. Sometimes, if symptoms are severe, a random blood sugar test can also be used. A level of 200 milligrams DL or higher along with symptoms is diagnostic.
So, once diagnosed, what does treatment and management typically involve?
Management of diabetes is a lifelong commitment, but with proper care, people can live full, healthy lives. For type 1 diabetes, the primary treatment is insulin. Since their bodies don't produce it, they absolutely need it, either through multiple daily injections or an insulin pump. It's critical for survival.
And for type 2?
For type 2, the cornerstone of treatment is always lifestyle modification, diet, and exercise. We'll talk more about that in a moment, but often, medication is also needed. This can include oral medications like metformin, which helps the body use insulin more effectively and reduces glucose production by the liver. There are also many other classes of medications, such as sulfonylureas, which stimulate the pancreas to make more insulin, or newer drugs like GLP-1 agonists and SGLT2 inhibitors that work in different ways to lower blood sugar and protect the heart and kidneys. Sometimes, people with type 2 diabetes may also need insulin if other treatments aren't enough.
It sounds like a highly individualized plan for each person.
Absolutely. A key part of management for all types is diligent monitoring. This usually involves regular blood glucose testing at home, either with a finger prick meter or, for many, a continuous glucose monitor, or CGM, which gives real-time readings. This helps patients and their doctors understand how different foods, activities, and medications affect their blood sugar.
And why is treatment adherence so important?
Adherence is everything. Skipping medications, not monitoring regularly, or making poor dietary choices can lead to those dangerous short-term complications we discussed, and certainly accelerates the development of long-term problems. Common mistakes include thinking you can skip meds because you feel fine, or underestimating the impact of a high-sugar meal. It's a daily commitment, working closely with your healthcare team, your doctor, a dietitian, perhaps a diabetes educator, to manage the condition effectively.
That holistic approach sounds essential. Let's delve deeper into those lifestyle and daily habits you mentioned. What are some step-by-step practical pieces of advice for listeners, whether they're managing diabetes or trying to prevent it?
This is where the rubber meets the road, Jenny. Let's start with diet. Focus on whole, unprocessed foods. Think fruits, vegetables, lean proteins, and whole grains. Limit sugary drinks, sodas, sweetened teas, fruit juices, and drastically cut back on processed foods, fast food, and refined carbohydrates like white bread and pastries. Practicing portion control is also crucial. A simple tip: fill half your plate with non-starchy vegetables, a quarter with lean protein, and a quarter with whole grains.
That's a really clear visual. What about exercise?
For exercise, aim for at least 150 minutes of moderate intensity aerobic activity per week, like brisk walking, swimming, or cycling. That's about 30 minutes, 5 days a week. Also, incorporate strength training exercises at least twice a week. Muscle tissue is more sensitive to insulin, so building muscle helps your body use glucose more efficiently. The key here is consistency. Find something you enjoy so you stick with it.
And sleep? We often underestimate its power.
Absolutely. Aim for 7 to 9 hours of quality sleep each night. Poor sleep disrupts hormone balance, including hormones that regulate appetite and insulin sensitivity. Try to establish a regular sleep schedule, make your bedroom dark and cool, and avoid screens before bed. These simple steps can make a big difference.
And stress, which is so prevalent in our lives.
Chronic stress can elevate blood sugar levels because of the hormones like cortisol it releases. Find healthy ways to manage stress, whether it's through meditation, yoga, spending time in nature, pursuing hobbies, or connecting with loved ones. It's not about eliminating stress, but about developing coping mechanisms. And finally, don't forget hydration. Drink plenty of water throughout the day. It's essential for overall health and helps your kidneys flush out excess sugar if levels are high. Ditch the sugary drinks and choose water.
Those are all excellent, actionable steps. Now, let's talk specifically about prevention. What can people do to actively reduce their risk of developing diabetes, especially type 2?
For type 2 diabetes, prevention is largely about adopting those healthy lifestyle habits we just discussed, even if you don't have diabetes yet. Maintaining a healthy weight, eating a balanced diet rich in whole foods, and getting regular physical activity are your most powerful tools. If you've been diagnosed with prediabetes, these changes are critical and can often reverse the condition entirely, preventing the progression to full-blown type 2 diabetes. It's never too late to start making those changes.
And how can families support each other in this?
Family support is invaluable. Make healthy eating a family affair. Cook nutritious meals together. Limit unhealthy snacks in the house. Encourage active playtime or family walks. When everyone participates, it creates a supportive environment and makes it much easier for individuals to stick to healthy habits. For type 1, unfortunately, we don't currently have prevention strategies because of its autoimmune nature, but awareness and early diagnosis are still key.
So what about those who don't have symptoms yet but might be at risk?
That's a great point. If you have risk factors like a family history of diabetes, are overweight, or are over the age of 45, it's really important to have regular checkups with your doctor and discuss screening for diabetes. Don't wait for symptoms to develop. Proactive screening can catch prediabetes or early-stage diabetes when it's much easier to manage or even reverse.
Excellent advice, Mark. As we wrap up this comprehensive discussion, what are the 4 or 5 key takeaways you'd like our listeners to remember today?
All right, here are my top takeaways. First, know your risk. Understand your family history and lifestyle factors. Second, listen to your body. Don't dismiss those early symptoms like increased thirst or fatigue. Get checked out. Third, lifestyle is powerful. For type 2 diabetes and prediabetes, your diet, exercise, and overall habits are incredibly effective tools for prevention and management. Fourth, regular checkups are essential. Don't wait for symptoms. Proactive screening can make all the difference. And finally, remember that diabetes is manageable. With proper care, education, and support, individuals with diabetes can lead healthy, fulfilling lives. It's a journey, but you're not alone.
Those are truly invaluable points, Mark. Thank you for breaking down such a complex topic with such clarity and understanding. I know our listeners will find this incredibly helpful and empowering.
My pleasure, Jenny. Knowledge is the first step towards better health, and I hope we've shed some light on this important condition today.
Absolutely. And that brings us to the end of another episode of the Health Awareness Podcast. A huge thank you to all of you for tuning in and joining us on this journey to better health. If you found this episode informative, please share it with your friends and family, and don't forget to subscribe wherever you get your podcasts so you don't miss out on future health insights.
Yes, please do, and join us next time when we'll be exploring the often overlooked connection between gut health and mental well-being. It's going to be a fascinating discussion you won't want to miss. Until then, stay healthy, stay informed.
Take care, everyone. See you next time.